A lot of what we talk about and we'll discuss today is about how safe are your schools, in your community. What do we know about the research as far as how to keep schools safe, how to keep our children safe, how to keep our communities safe. So one of the focuses that I've had for the last 8 to 10 years is on violence prevention, but also how to maintain schools and how to help schools keep safe environments, both physically, mentally, and health-wise. So that's some of the things that we'll be talking about today. Well, I see you're all off of your lunch break for now, or perhaps you're having lunch while we're talking. That is just fine. I would do the same, except that you wouldn't be able to understand me. Let's get started. We have about an hour and 30 minutes, so feel free to have lunch while we're online together. Feel free to take a break. Feel free to ask questions along the way. I am not a type A personality, so I kind of go with the flow as we walk along. So today I'm going to talk about what happens in a school district when there is an extreme trauma. I'm going to talk about what the response to that is. I'm going to talk about how schools create plans for crisis, and what are the strengths and weaknesses of those plans. So you can actually go to the school district in your communities, ask for the crisis plan, get that, and you can compare that to some of the findings that we have here today and some of the findings I've done in my research over the years. So there are topics and issues and stories I will talk about today that are upsetting. There is no way to talk about crisis without talking about some upsetting things, and I want you to know that sometimes it's not even easy for me to talk about those. So I want you to feel free to take a break. I want you to feel free to, ask a question. I want you to feel free to walk away from the computer and do what you need to do to make yourself comfortable again, because I know, working with professionals all the time, we talk about self-care, but we don't do it. And the same is true for parents, the same is true for school personnel, and all those things. So I truly believe that I want to make sure that you're comfortable today, and the discussion that we have today will not cause you concern or anxiety. Okay, these are really the goals that I'm going to talk about very quickly. So I'm not here to replace a crisis plan. And the reality is, across the country, research shows about 96% of all schools have a crisis plan. What happens, when the building is struck by a tornado? What happens when, to a lesser, a degree of crisis, what happens when someone, gets violently sick in school, or unfortunately dies in school or on the way to school? How do you deal with those crises at the time and in the moment? And so we'll talk about that. I don't have any plans to replace a school's crisis plan, but what I have done a lot is go out and talk with schools about how to enhance or how to think about their plans in perhaps different ways. Because what I found is the plans that the schools are required to fill at the state level are basically check boxes. Does this do this? Does this do this? Does this do that under these different circumstances? And does it, if you have a bomb threat, if you have a bad weather threat, if you have a flood in your school, does this plan meet those needs at the time? And mostly it's a checkoff list, which is fine. But a lot of times schools just check these things off without really thinking of the implications of those, and I'll get to some of that. The other thing I help schools with is to think about violence prevention. When schools think about violence prevention in these crisis plans, a lot of times what they think about is how to safeguard their school from a person entering the school with a weapon. Violence prevention is a lot more than that. Violence prevention is wellness, is presenting programs and services and the mindset that we can help these children in our school districts lead healthy, productive lives and give alternatives to violence. And we can teach those skills. Those are very teachable in the moment skills. So that's one of the things that we talk about as far as what when we're talking about violence prevention. I've added this piece in just the last year about COVID-19, how that has affected our kids in schools, how has that affected our kids when they're in home learning and they're not in their schools. I know there has been a lot of national coverage of school board meetings across the country where people are livid about wearing masks, people are livid about not wearing masks, and everything in between. And so this part of trauma and grief is constant at this point right now across the United States. And I think it's one of those things that really tears communities apart, really affects the mental health of our children, as well as the mental health of adults that are a part of that. I'm going to give you an overview of a model that I created after a school shooting in our own community that I had not seen as a result of previous school shootings around the country. And so we're going to talk about that for about the second half of the time we shared together today. And it is really a very specific model about what to do after a crisis in the minutes, the hours, the days, weeks, months, and years, actually, after a crisis. And so we're going to talk about that specifically. And probably more likely, you're going to have to deal with what happens when it's the school next door. When a school that you're involved with or your children go to, or that you have a relationship with, a professional relationship because you're providing programs or services to those school children, what happens when it's in the other district? What can you do? What can your school do? What can the administration do for the school next door, the school that's hit by the tornado, the school that has a shooting? What can you do in those circumstances, and how can you be a part of the recovery process for those schools? Because the odds are it won't be at a school that you deal with directly, it'll be the school next door. A little quick on the draw. Okay, so why am I here? Why are you listening to me? Well, because you didn't have anything else to do at noon on a Saturday afternoon. That's really sad, but because you're also dedicated and you really want to learn about how to make your schools, how to make your communities better. And I really appreciate the time. 12 o'clock on a Saturday afternoon is not the best time to have a conference. So, but it does allow parents and school teachers and school administrators a chance to be at these conferences. So I really appreciate the Federation for doing that. But more than that, I appreciate your taking the time to be here. Just as a side note, I am taping the Ohio State University's football game that started at noon. So please, nobody send me the score in the chat. That's my one request today. I'll go up and watch it, fast forward through that later on today. I'm here. I got started in this process literally on one day, February 27th, 2012. An individual entered the Chardon High School lunchroom and proceeded to shoot 6 students, resulting in 3 deaths and 1 student permanently paralyzed. At the time, I also had 3 family members in that school. And at the time, I was the chief executive officer and am still that today of the Geauga Board of Mental Health and Recovery Services, who is in charge of all mental health and drug and alcohol services in our catchment area. And Chardon is in our catchment area. And so we fund all the mental health services that are in that school, as well as adult and other school districts. We have 7 school districts in our catchment area. So as the Chief Executive Officer, we have oversight for Chardon schools and Chardon itself. I found few resources available for what to do next, and these are literally the minutes after the shooting. I was on my way out the door at my house. I just happened to have the news on. I was drinking my last bit of coffee as I was leaving the house, and a news flash came on that there had been a shooting at Chardon High School. And I knew that was in my catchment area, and I knew we would have professionals there within a few minutes to help with the mental health and the health and safety of that community. So one of the things that I did find in creating a plan as to how to look at the next days, weeks after the shooting was that there were not a lot of experts in the field, and I had called around nationally to find them. And when the experts in the field across the country all ended up giving me the same 3 or 4 names, I knew those were the people I wanted to talk to. And one of them was at Virginia Tech, who had suffered a huge shooting in years before, and the other was was in fact the principal at Columbine High School that had also been principal when they sustained their shooting. So for days and late into the evening, sometimes we would talk, and I would be creating this plan that we would implement at Chardon High School and in the community. So that's how I got started in this, and I realized that it was something that needed to be done pretty quickly. And so we had, within a couple hours after the announcement of the shooting, we had a plan in place for how we would address, different issues over the next days. And then eventually we expanded that. I was able to expand that into a longer range model. After that, I was involved in research with University of Toledo. Was our first start in researching, because we tracked kids that were in the school. We tracked them for 5 years after the shooting and what happened to them and what were the outcomes of those individuals. Then I was invited to work with Duke and UCLA to study several mass school shootings across the country. And finally, Hazelden Publishing, that's the Hazelden Betty Ford Foundation publishing company, asked me to write their national manual, preventing, intervening, and recovering from a school shooting and other traumatic events, which came out this spring. So those are how I got involved and how I've been involved in this for many, many years, doing research and now consulting with schools and talking with all of you, hopefully. So I already talked about, most schools have a plan. It's public information for the most part, so you can have access to it. One of the things that people don't realize that became evident very quickly was this event is not just a school event. It involves the entire community and beyond, because what happens in a crisis is that not only the school staff, not only the school kids are involved in the process, but think of it this way. Those kids that are victims, those teachers that are victims or are harmed or are in trauma because of what's happened, no matter what it is, they have friends, they have loved ones that are in other school districts. Kids play, are on ball teams together. Some families are split so that siblings might be in other school districts. For all sorts of reasons, this school community and regional event becomes a huge, huge issue. And you can imagine that for whether it's a shooting or whether it's a tornado or whether it's an unexpected death of a loved school teacher, you can understand how that spreads and that trauma and that grief can be, communally shared. And so one of the things that became very obvious was that the community was involved in it as well. And we had to come up with a plan for how to address the trauma and the grief in the community as well as how to do that in the school. It's a long-term process, and often school boards and school districts and the community want to treat it as something that you get over quickly. And I get that. I understand the urge, the need to say, let's move on and get past this. schools don't want to be known as the school with the shooting, or the school that was destroyed, or the school where, where kids were harmed, or so there is this innate sense in us to be able to move forward and do that quickly. But I have worked with at least 10 or 12 schools with major shooting events and trauma events, and that was the case in each one. And in each one, I was able to kind of talk them back a little bit to think about how to heal the individuals that were already in the school and would be in the school for a long time. And that includes, if there's a shooting in a high school, guess what? Those students that are in the high school have siblings, have younger siblings in elementary or middle schools. And so they are affected by that as well. Some people, and so there's this whole process about moving into that school where a shooting occurred, or where, a death occurred, or a harm was incurred. So people have to learn to address that early on with kids, and know that it's going to be there for years to come. As a matter of fact, the Frank DeAngelis, the principal at Columbine High School, he made a pledge not to retire until the kindergartners that were in that school graduated, and he did that. He stayed for 12 years after the shooting to make sure that they were safe, and went through that process. So I'm going to talk about some emerging best practices now in my next few comments, and I'm going to talk about how some of the prevention that we have implemented, how that makes a big difference in violence in the years to come. So the question Joanna asked is, what did you find the most challenging on responding and creating a crisis plan? So many things. I found, I'll tell you what was the most surprising and difficult in some ways, and that was the resistance. The idea that this really is not a big issue as you think it is, Jim, and we should just move on, and we should, not provide programming to kids in the school. We should not provide, services, or because that'll just perpetuate the idea that we had a crisis. And I think that's true in many schools. Ironically, some of the things that you might think were more difficult were not. For example, how do you fund it? These are very time-intensive programs we're talking about in responding to a trauma, not just for mental health professionals, but think about it. I mean, in our situation, we had deputies and police and fire and FBI and Secret Service, and we had these people, on the grounds for weeks. And the sustained police force, they increased safety around the school for the entire school year. The shooting happened in February, but they increased the police presence for the rest of the school year, and then even into the next school year. So think of the overtime. So the cost was, was one of the things that we looked at very, very early on, and it became one of the few things that we didn't really have to worry about very much. The state poured money into the school district, poured money into the safety officers that were there. We also, there's also a federal grant that I talk about in the book and in some of my programs about, there's federal funds that you can apply for. And so funding wasn't a big issue, but accepting and acknowledging the level of trauma that people had was very, very difficult. And I think people really wanted to move forward. And the other thing that was very difficult was we had one of the individuals that came in to help the community and help the school was a so-called expert in crisis, and had worked in, had done some work in school shootings. and his suggestions just were not best practice or emerging best practice. And so we really had to, to push the school to think about what they were doing and how we could work collaboratively and do the right things based on what we knew. So great question, thanks. Mass school shootings, there are different definitions of what a mass school shooting is. And I'm going to talk about that just because you see statistics all the time about, oh, there's, all these school shootings or whatever. There are school shootings, and they have kind of gone up and down over time. You see some of these. I'm not going to talk about the statistics. That gets you can have a whole hour and a half session on just the statistics of violence in the schools. One thing to know when you're looking at, or when you hear about school violence, it is school in general is considered school-sponsored violence or school-sponsored events. What's happened here in just this school year alone, there's been a couple of shootings at football games after school, but yet those are considered as school shootings because they are school-sponsored. So if you're on the way to or from a school-sponsored event, that still counts as violence. One of the things that I see a lot is when I go out to schools, and I'll spend a day just walking around the school. I'll talk to teachers, I'll talk to students, I'll watch how the school runs. One of the things I've seen over and over and over again is that they might have a school resource officer inside the school grounds, but after a football game, there may be police in the stands at the football game, but they don't walk around the parking lot. And that's where the violence happens. And so it's things like that that people kind of get immune to seeing or hearing that, that I try to make sure that they're aware of and how to increase the safety, around these school events. So, and the other thing to remember is that most, and when I say most, I'm talking about 95 to 97% of the school shootings that happen in the United States are targeted. It is a one person looking for another person, and usually with a weapon and usually with a gun. And so only a small minority are mass shootings. Mass shootings are 4 individuals or more. This is the FBI and United States Secret Service definitions for mass shootings right now. The majority of individual shooting violence within a school is one-on-one. There are several cases that I've documented where it may be a revenge act of violence. So one student may be looking out or looking for another student, and someone gets in the way. That actually happened at a small school district in Ohio where the student had gone into the restroom to take out a gun, load it or whatever. Another student walked in, not the person that the perpetrator was targeting. Another person walked into the restroom, and the perpetrator shot him and never shot the intended victim. So the boy recovered. But that was a perfect example. And there was another one in another school district where, in fact, a school teacher and a student got in the way. They got shot. The intended victim was never harmed. So it really happens that those incidents are not that uncommon. You can see the average school time between shootings significantly dropped there through 2018. The numbers for 2019, 2020, et cetera, are all going to be skewed by COVID. But I'll tell you what, I don't know about you, but I have been shocked by the amount of shootings that have happened just since school started again this fall, whether it's August or September, depending on the school district. I had hoped there would be a grace period in there, but in fact, I think what's happened is it's almost like these revenge shootings have compounded themselves over COVID because they weren't seeing students weren't seeing each other. A lot of this anger built up online And so I think that's one of the reasons why you're seeing more shootings these days. Yeah, so I can clarify about 4 people to be considered a mass shooting. What I'm not clear is the day. Oh, I'm so upset. Yes, I can clarify that. So the way the wording is right now, and there's a couple different websites. There is, I'm sorry, I should have this in front of me, but there is a website that tracks school shootings, and there is the FBI, and they share this definition. That is 4 or more people shot or killed in a single school shooting, not including the perpetrator. And so 4 victims in one way or another. So that's what the definition of I'm using for mass shooting in a school. It will vary. So make sure when you hear the statistics, make sure you understand what the definition is. But I've decided to make sure that people are, I try to be clear. Thank you. I do try to be clear about that, because there's a lot of different definitions about that. And I was shocked. When you get thrust into the middle of these things, one of the things that I didn't know until it happened in our school district was, would you care to make a guess who actually is in charge of investigating a school shooting? It's not the local deputy, it's not the local sheriff, it's not the local police department, it's not even the FBI. It's actually the Secret Service. And so when the Secret Service showed up at our school district, that was really quite surprising. I did not know that. And then afterwards, I actually have done some conferences with the Secret Service and FBI on their research as well. So it's been really an interesting journey. Okay, 50%. Give a warning. These are usually online. They can be to friends or family members. So we know, because of that, these events are often preventable. Now, on the other side, schools do have responses to natural events as well. And so a lot of that you'll see here in a minute as we get further and further into this conversation, a lot of that will overlap. The response to a major tragedy can be similar, because a lot of the things that happen, a lot of the just logistics that people don't think about that need to be planned for can apply to more than one situation. So while I talk about school shootings, I think we need to make sure that we understand that that is very broadly based. So I don't think I'm going to talk about prevention a whole lot today. Usually I can, I'll do a whole session on prevention in the morning, and then I'll do another session on response in the afternoon or something like that. The other thing I've done is do some of this fundamental stuff in the evenings. I always insist if I come out to a school district that they have an evening session, that I'm able to meet with family members, that I'm able to meet with community people and talk about these very same things, so they're not on different pages when they look at how to create a more effective prevention plan. So I always insist that we do a public time where I can talk about these very same things that I can talk about with the school superintendent and the mayor and things like that. So I'm really big on the ACEs idea in reducing those adverse childhood experiences. I'm going to take for granted that a lot of you have some experience with that. I'm not going to spend a whole lot of time on that, but I will say that, the more likelihood, if you have an adverse childhood experiences, the more you have, the more likelihood you have issues around even your health, your mental health, your behavioral health, substance abuse, all those issues increase in your chance of having those poor outcomes as the number of adverse childhood experiences increases. So one of the things that I really have used a lot is that, and that's the Search Institute's research on asset development. And so you'll find that in a lot of the things that I've written. And also in my comments today, I want to make sure that we, that you understand that these are all based on some quite major research into both the ACEs and into how community assets really make a difference in reducing the exposure to violence and these adverse childhood experiences. Here's the thing, if you haven't studied them, one of the things I wanted to talk about just briefly is with adverse childhood experiences, it doesn't talk about race. It doesn't talk about poverty. It doesn't talk about a lot of things that influence our children and create more difficulties for them as they grow and develop. So, and the ACEs only looks at like exposure to violence and some of those things. So it is being, they're actually working on a new model, and that may even be out, that looks at what other kind of community situations you find yourself in that may in fact impact you and your long-term health and mental health. Oops. Okay, so prevention. These pictures really have a purpose. One of the things about preventing violence is providing for assets in the community, providing outlets for kids, providing positive experiences for kids. One of the things I talk about in detail is identifying and assessing the needs and the resources of your community. One of the things that I talk about in depth is finding program deserts. So our kids may be bused to our schools, or they may be able to walk to our schools, but some of them walk through very difficult neighborhoods. Some of them experience violence every day. And so I am big on promoting the development of after school services, of support services for our kids and our families where they live. And that could just be 3 or 4 blocks from the school, but that can be a world away physically from the school. And so to make sure that our kids can get to those resources, one of the places I talked to, they had done this huge needs assessment that I helped them with about what they needed, were there after school programs, things like that. And they found out that there was an after school program that was about 4 or 5 blocks from the school, but nobody was using it. The numbers were way down. The reason they weren't using it was the only way that kids could get to that after school resource was to walk, and they walked through a very dangerous neighborhood. And so in that case, what you can do is set up a carpool or some sort of bus system to get them to that program, because if they're not accessing these assets, then they're not really the prevention is not really in place. So you can see after school or sporting events, being involved in sports, having the community acknowledge special dates and accomplishments, the birthdays, the anniversaries, the newspaper article that says this child was student of the month or got an award for handwriting or something like that. Being able for your communities to acknowledge that is an important piece of the strengthening of that prevention piece for our students, because they get that, they feel that, they understand that. One of the things our school district does, and it surprised me even now, is that they actually, if there's kids acknowledged for scholarship, acknowledged for athletic ability, but also acknowledged for the arts, acknowledged for community service, things like that. They actually bring them to the school district for the school district's weekly meeting and acknowledge them in public, and they get press for that, stuff like that. So the one thing I hesitate to talk about that is because a lot of kids that we want to help will never make it into the newspaper. They will never make it in front of the school board for acknowledgement, but yet they have gifts and graces as well that we need to learn as a community. That's why the group work, a lot of you guys, your schools are working, have kids working with groups. And the reason I got the man and the boy there, mentors are one of the biggest things we see helping our children develop healthy lifestyles. And that could be a mentor of any kind. It can be a coach, it could be a religious leader, it can be a neighbor, it can be a Boy Scout or a Girl Scout leader, it can be, you name it. The relationship with that child is so important, and it helps when that is outside of the family. And so that's why kids involved in the community programs is so important, because they get that context of what an adult, they have a good example to learn from, and what adult being a community and healthy adult really looks like. And so that's what some of those assets, and you can find that in the Search Institute information about, what are the main assets that make the biggest difference. And that's not a big output of funding to do those kinds of things. One of the things that I really believe in is we fund Big Brothers Big Sisters, because it does amazing things for kids that often don't have a parent in their household or are struggling. So that's one of those mentoring programs, but it can be anyone. All right. Prevention is more than physical health, and that's what a lot of schools have to focus on. I think it's just as important to focus on the emotional piece as well. We have a lot of kids that are bullied. They can do it online now. They can do it on the bus now. And the other thing that I want to just mention is, when we talk about bullying, the first thing that comes to mind, even for me, is somebody texting someone, or someone getting on one of their accounts, Instagramming something nasty about another child. But in fact, a lot of times what we don't acknowledge is those day-to-day microaggressions, that happen in our schools all the time. And I think that's one of the things that's so frustrating to me. We talked, I don't know if it was Renee or somebody that was asking about one of the most frustrating things. That's one of the most frustrating things. In talking with school districts, they don't acknowledge that these microaggressions are happening all around them. And it can be for minority students, it can be for individuals in the LGBTQ community, it can be for kids, that are overweight, or you name it. These better than I do. You understand those issues better than I do. But to get school districts to acknowledge that and to start to address those with bullying prevention programs and things like that, that's like pulling teeth sometimes, because they don't want to believe that that's happening, and they certainly don't want to believe that microaggressions make a difference to our kids, but they do. All right, asset mapping. This is the example I gave about the school district where they didn't have any, they had a program in the community, and this is literally a map. In large part, you actually put together a map of your community around the school, what's available to your kids. You put pins in these maps. I create a chart as to what that pin means, what's available, what age group does it affect? Is it are the kids that are coming home to no parents going to these after school programs? What about the ones that don't? Are they, and so you look at what assets you want to create, and you look at what ages and what things those programs will help to enhance. And so it's not, I think a lot of times schools and communities don't take the time to do that. And I get it. It is a bit time consuming the first time you do it, and you look at asset mapping. I created this phrase program, deserts, and because a lot of schools don't have anything around them. You can't walk, you can't bus to them. There's just nothing available to these kids after school hours, and so that's one of the issues that that's one of the reasons why we can talk to kids and find out that they're joining gangs because there's nothing else to do in the community sometimes. So the asset deserts, like you can see very quickly on a map, how close services are to kids and how they can get there. So not only do you identify what assets are out there, you also identify what gaps are out there. What is it you're trying to prevent? So if you're trying to prevent kids being involved in tobacco at 12 years old, that's a whole different look than if you're trying to prevent bullying. Now, there are some programs that will help to prevent both. And so those are some of the services that are available. There's some national things out there that will look at kind of a very broad picture and definition of prevention, and they actually try to enhance the assets and enhance the child development because they are kind of broad scope prevention services. Here's some of the things that you find in your schools already. You have recreational, educational things. You have the after-school programs. Again, but you see on there after-school transportation. If you can't get there, it isn't a support. So that's the kind of thing I'm talking about. Are there adult mentors? The other thing that's an asset is like things like that are part of the school curriculum, whether it's being in band or whether it's being in a musical group or whether it's all the recreational things I talked about before. Those are all assets in your community. And one of the things I see is that when budgets get tight in schools, those kinds of things are eliminated first. The reading, after school reading programs, or the arts, or music, all of those things tend to be eliminated first. When some of our gifted students have those as assets that they can build on, but if you take them away, they have to find something to replace it with. So I heartily endorse trying to maintain some of those things that are more holistically age and educationally appropriate. So there's community-based then as well. So there's rec centers, there's community sports, there's counseling, food banks. One of the things that we don't do enough with our kids is get them employed. Our older kids especially. Yeah, well, 6-year-olds aren't exactly going to deliver the paper necessarily, but 12-year-olds can. And 13 and 14-year-olds can learn how to babysit and can work now with the labor shortage. They can work younger and younger. The laws have been changed a little bit, and so that can be squeezed in if that's something. I found in my history of counseling and overseeing so many programs over the years, we literally do cradle to grave services. I found that we underestimate a lot of times the kids that might come in as troublemakers or might come in as for smoking weed or something else. We underestimate how gifted they are many times. So that's one of the things that I think is we have to look at better. So this is talking about creating a prevention task force. The task force is designed to go out and find those assets, is do the mapping, identify the needs, identify programs that can meet those needs. This list is probably, I hope, it challenges you. I hope this list includes people that you have not talked to or that your school does not include, because there's a lot of this community political and business leader individuals that can have a difference and can make a difference, and we don't talk to them. We don't invite them to talk to us about developing these assets for our kids. And sometimes they have some wonderful resources that we aren't tapping into. And again, it kind of comes to my theory that, all prevention, all violence prevention around these traumatic events is community, affects the community as well as the school. Some of you have probably have some very unique groups that could, enhance your prevention process. they've developed a, in the chat, they've developed a team ambassador development program as well. Yeah, I love that. That's great. Absolutely. The other thing we don't do is use our teens to mentor younger kids. We have several programs now in our school districts where teens in high school get trained by big brothers, big sisters, as a matter of fact, to go into and do after school programs with like 3rd and 4th graders with an adult supervisor. You know, the kids that go home and don't have parents at home, they now can stay, they have recreation, they have food, they help with their homework, those kind of things. And guess what? Those younger kids adore those high school kids working with them. And so it's really a really important asset. Yeah, I'm really in favor of, Carolyn says, probation, youth diversion offices, and court services. I am really in favor of the youth diversion programs. And I talked a little bit about resiliency programs and restitution programs in schools. A lot of the comments I hear from kids, especially around that microaggression, I think there's been some research about that, is that they don't feel like there has been justice done. And I think that's one of the things that some of these resiliency programs and restitution programs actually help to provide to those kids. And guess what? Unfortunately, I've seen some cases where those kids that felt like they were bullied also become the perpetrator in school shootings. So we have to be aware of that. These are some of the skills that we can be building. And this is for adults too. I don't think we do a very good job of helping our adults. You know, I talked about coaches, I talked about religious leaders, I talked about a lot of adult mentors. I don't think we do a very good job of identifying and teaching them how to report child abuse or suspected child abuse. The other thing is that we don't, until it happens, I don't hear a lot about, and that's environmental concerns. And testing. You know, lead is still a problem, unfortunately, in many of our schools, as well as other things that, you know, that are unhealthy for our kids. COVID-19 is, you know, just one of those slap in the face kinds of things where, oh yeah, we got to be figuring out how to deal with that. I'm watching the time, so I'm going to move forward. I talked about the prevention stuff a little bit. Recognizing mental health issues in kids is a big issue with teens, as far as even teachers in schools aren't very well taught and coached in how to identify those issues and how to make an appropriate referral. You know what? Who else isn't? Physicians. A lot of family physicians are not taught well how to identify those mental health issues. And guess what? There are screening tools. You can literally have a screening tool that's been evidence-based, you know, 3 questions to find out, you know, that you ask a child when they come in for their checkup or whatever. And so there's screening tools that we should be using. Every doctor should be using, in my opinion. So, and they're quick. And some of them, here's the other kicker. Some of those screening tools, they can actually bill for. You know, the 10 questionnaire piece that you can ask in your office, you can actually bill for that sometimes. So it really is in their best interest in all sorts of ways. Okay, let's move on. This is one of the things I wanted to say about school shootings, about schools. When I talk with schools about school safety, the first thing they say is, oh yeah, we've made the building safer, the outside doors are bulletproof, or we have a metal detector, or we have cameras everywhere, or we have line of sight buildings now. And so that's when they describe to me what they've done for safety in the schools. That's what they described. What they don't describe is how have they improved the safety of a child's mental health. how have they improved the prevention services and crisis plans that are in place that address a child that is in trauma. And so that's why I say preventing school shootings, it's hard, it often gets translated into, hardening practices, sheltering place, et cetera. And I'm sure some of your schools do this too. There's no question. Perhaps, your school has done an ALICE, active shooter training. Actually, Chardon High School, where the shooting happened in my community, that school was the only school in our catchment area that had done an active shooter training with the students in the school. Many times when a school does an active shooter training, they remove the students, they leave the staff there and teach them, but in this case, Chardon was the only school that did. Higher low-tech methods. And I'm just going to give you one example of that. So one of the kind of low-tech methods of looking into guns and weapons in the school is to create a single entry where students have to come through a metal detector, and they use that as their safety measure for eliminating or reducing weapons in the school. The last time I saw that, they had the metal detectors and kids were coming through the metal detectors, and one problem was there was no one at the metal detector, no adult safety officer or anything that could actually physically take a gun from someone that put it through the metal detector. So if they found something, they were stuck. They didn't know what to do next because they had not thought through the process of, okay, so if somebody brings a gun in their backpack and all of a sudden the beeper goes off and that child is like reaching for the backpack, and what do you do with that scenario? How do you remove the weapon quickly enough and have the staffing there? And that's expensive. Having all those staff available is an expensive piece. Here's the other thing about that. I see somebody in the chat, I'll be right there. Here's the other thing about that. So they were worried about guns in the building. What they didn't think about was, because those kids at that time all came into the building at the same time, out on the street and out on the sidewalk were hundreds of kids waiting to get in. So if I'm somebody set on hurting someone, it is smarter for me to stand outside and harm a lot of people that are helpless to get away because they're all crammed together, than it is to try to sneak a gun inside. So those are the kind of things that people don't really think about in the practical application of some of these prevention programs. Principal at a charter school in Houston was shot by a former student trying to get to a staff person. Yeah. We certainly want to just move past the event, challenge the mindset adults to truly support kids. Thanks for the comment. I really appreciate that. Go to, if you want to contact me for any of this information, go to Rise 4 Solutions. Rise, the number 4 solutions at gmail.com. I couldn't tell, I couldn't see the slides, but online they may be there, so that may be my bad. But I'll be happy to send you the presentation. We're working on getting out. I actually worked with this state of Texas when there was this shooting at Santa Fe, I believe. I worked with the state about this model, and so I would love to come and see you again. I really appreciate it. So anyway, moving onward. Okay, active shooter drills. I wanted to show you the difference in active shooter drills that are out there. On the left, that's how many schools interpret an active shooter drill. On the right, that's how other schools interpret an active shooter drill. Just talking to students about what it means, talking through a process, because the odds of having an active shooter in your school are still so low that the odds of creating trauma within kids dealing with an active shooter training and the weapons and the individuals on the left-hand picture do that. And so I want every school to review the pros and cons of all of that information so that they make an informed choice. Right now, the informed choice is too often, let's bring in the guys and women with the guns and we'll deal with the trauma later, or we won't deal with it at all. And so that is not a good preventive measure. Yeah, so there's some very simple things that schools can do that they aren't today. That's why I really am trying, you can tell these slides are just kind of kickers for me about these stories. So that's why I really like to get out and talk to individuals about their particular plan. But one of the comments was that, Columbine didn't have accurate floor plans. That's exactly right. The other thing I don't see a lot of times is when, a simple way to create another preventive measure is to have the classroom numbers facing on the window outside of the building. So responding individuals, and whether it's law enforcement or whether it's a medical emergency, they know where to go, because a lot of times they'll get a text from a school member, or actually in shooting cases, it's virtually always text from kids in the school are able to text out. And so they can know where a classroom is, where a perpetrator is, or where there's a medical emergency immediately by coming to the school and just looking at the outside of the building, and they know exactly where that school classroom is. In fact, in Chardon, the kids were texting, and they were texting where the shooter was within the school as he moved. And so the police that arrived had a pretty good idea where that shooter was when they got there, because they had real-time information from inside the school. Again, what are the chances that your school will ever have an active shooter, and who is doing the active shooting? So many of these places, they say it's best practice. It is usually not, because guess what? Best practice, the gold standard for best practice, is actually studying people that or places that have used this technique over places that have not used this technique that still have the same outcome as far as like an active shooter or an active natural event or something like that. That has not happened. There has been no statistical comparison, research comparison that I know of to date. And it's very hard because these are such small number of incidences. So that would prove that active shooter training is best practice. I encourage a lot of caution around active shooter training. Here's the other thing that happens with active shooter training. People that are in the school learn how to shoot because of active shooter training. They learn where the weaknesses are in the setup. And I'll give you a perfect example. In one school, they did an active shooter training, and guess what? One of the individuals that was in the school went through the active shooter training and learned that if he hit the fire drill alarm, that would put more people into the hallways, which in fact happened. And in fact, there were victims in the hallways because of that. So it's not always in your best interest to have active shooter training in any given school. All right, I'm going to move on. We talked a little bit about this, first responders. I have very strong opinions about school resource officers, what that should look like, what their credentials should be. You should not just put one in just for the heck of it and without training. They should be certified. Schools don't bother to go through that process. And what are they for? Are they there to learn the school building in case there is an emergency? Or are they there to help prevent those violent emergencies because they build relationships with students? That would be my first choice. And I haven't always been able to talk schools into that. Some schools to this day that I've worked with have rotate police officers from their local police department in and out of the school because they think, oh, well, then they'll learn where the school is in case there's an incident. I would prefer they put somebody in the school and leave them there so that they can build relationships with these kids so that kids can come and talk to them and warn them if there might be a chance that someone would be violent. That I think would be a much better outcome in my own humble opinion. All right, so let's really quickly touch on what happens after a shooting or a traumatic event, like a horrible natural event, happens in your community, happens in your school. Okay, middle of the day at your community high school, students are in the halls outside for physical education class. Yeah, don't forget, kids are outside virtually all times of the day. And so if your school has an emergency warning system, an auditory emergency warning system, is it on outside? Do kids know that it's, what to do if they're outside? What happens at your school if the possible shooting incident comes to the forefront? All right, so crisis plans. If we were together, I would have you spend 5 minutes, I would time it, write as fast as you can. What would you do in the first minutes after a shooting? And taking for granted that the shooter is out of the picture, is safe or off the campus or whatever, what would that look like in your facility? And you can imagine, some of these hopefully would be on your list, others perhaps wouldn't. Who has the authority in your school to call a lockdown? Who has the authority to release kids after a lockdown? Think about it. Is it the principal? Is it the school superintendent? What if they're not available? What if the school secretary and receptionist gets a call from room 122 that they just had a student leave with a gun out? Who has the authority and the ability and the training sometimes to deal with that? Most schools never consider that single first step that they need to do to safeguard their school itself, their students. The other thing that they don't consider is, back to the shooting where the perpetrator set the alarm off, the other thing they don't consider is, what about the kids that are in the hallways? Because in most traditional lockdown settings, you immediately close and lock the classroom door where you're in, you turn the lights off, you remain silent, and you maintain that position until you're released by presumably a first responder. But you've just trapped perhaps dozens or more, which happened in this school, of kids in the hallway that cannot get into a protected area. Where do kids go in common areas? If there is a lockdown called and it's during a lunch period and you have a lunchroom full of kids, where do they go? Where does the band go if they're practicing on the field, or the football team that's practicing? How do they know that there's an emergency, and where do they go? What if the perpetrator leaves the building or is outside in the first place? Where do those individuals go? So all of these scenarios have happened, and so they should be part of your emergency plan in the first days, in the first minutes afterwards. So another thing that's on here that I'll bet would never be on anybody's mind, and that is in the, once the school is secured, once the kids are starting to be released from classrooms and things like that, who do you call? One of the things, you've already called the police department, first responders have released kids, et cetera. But one of the things that people don't think about is they got to call their insurance company, because a lot of school insurance companies actually have responses to these critical incidents. They actually have protocols on what you can do and what you should do for a tornado or some sort of incident. They also have what school boards will be interested in is they also have protocols for liability. And so they want you to say or do the right things in that situation And one of the first things you're going to do is communicate with the community about what happened and what happens next. And so the insurance companies, several of them that I know of, have set up a specific protocol to follow for the school districts that they insure. Can you tell I'm trying to talk about a million things at once here? I hope, if nothing else, during this process, I'm laughing because even though this is a very serious process, I hope you get a feel for how intricate this becomes. Once we start to talk about all these details that you have to think about, in these situations, I hope you understand that that's one of the reasons why, I hope some of this information gets into schools' hands. I hope I get invited to some schools to talk about this stuff and go into more detail, because I think it's beneficial. I think it's stuff that people haven't thought about before. Okay, so in the first minutes, right off the bat, moving kids out of the school probably. Remember, if the school is hit by a tornado, that it's a dangerous site. If the school has a school shooting, it is a crime scene. You must leave the premises. I told you, you might see the FBI or whatever. And so that's important to know. Where are you going to move these kids to? What place have you set up beforehand to send these kids that is safe and away from this building? And how will you get them there? Do you have enough staff? Do you have enough bus drivers on time? At 11:30 in the morning, do you have enough bus drivers? Most schools don't, on hand to transport those kids home. What I suggest is a reciprocity agreement with other school districts around you that would share, buses, that would share staffing, that would share. Guess what? You're not going to have a cafeteria, but you're going to have volunteers, or you're going to have first responders in that school, perhaps for days or weeks to come. How are you going to take care of them? So even cafeterias to share food and provide resources like that in an agreement with other school districts around you. This is everybody has their role, in a crisis, and this is kind of just an overview of what that might look like. What do the school staff do at that point? Who has the right to speak? Who has the right to stand in front of a microphone when the TV camera comes on and speak for your school? The social service agencies, mental health professionals. So in our case, if you're a first responder, if you're a mental health crisis responder, and you have the skills, you've been trained, you have to be trained to know what to do in a crisis in trauma-informed care, and you're trained in doing that, and you show up at the school, what do you do? And the quick answer to that, and the easy answer to that, is anything that needs to be done. Trauma-informed care means anything that needs to be done at that moment. And so in this case, the mental health professionals helped to link students back with their family. You have to be able, can your school print out a list of individuals, all the individuals that were in that school that day at that time? Because you have to do a checklist. You have to make sure everyone is accounted for. And if they aren't accounted for, where are they? Because they may still be in hiding. They may be a victim somewhere. And so we have to make sure that we can account for every child, every staff person, every teacher that was in that building on that day at that time. So, and that doesn't matter if it's a natural disaster or if it's a man-made, a human-made disaster. We have to be able to do that 24/7, basically. So this talks about the minute-by-minute response. Yeah, I saw about there are kids. There may be kids, and there were in our case, there may be kids coming to the school in a bus. They literally had to turn them around and send them and drop them back at their homes. One of the things that was interesting, and I appreciate it after time, was that Chardon decided not to put in metal detectors at their school for several reasons that I've talked about, but also one other thing, and that was, if someone's really going to come to school with the intent of harming someone, they may well do it at the bus stop, because those kids waiting at the bus stop are totally in a position where they are unprotected, where they are not safe. And so that was one of the reasons cited not to install metal detectors in our school districts here. They all have to be accounted for. They have to be, parents have to be linked to kids. And that means that your list of attendees at the school that day also has to show who is eligible to pick them up, because sometimes the parents are at work in order to reunite their families. And how can that, the other reason for the press release is, and talk to the press is, you have to tell families where to meet their kids. Because if you have a school of 600, you're not going to be able to call 600 parents or send out, you know, a text. I hope you have mass texting abilities in your schools by now, but because that's one way to connect with the parents. But a lot of those parents may be at work, maybe, you know, may have to travel in. And so what do you do with those kids in the meantime? How are they going to be reunited? When law enforcement comes in, it becomes a crime scene or a natural disaster scene with safety issues. So they have to make sure the area is clear. And guess what? The kids that and staff and administrators that left that building left all their stuff at that building. Most of the time you don't have time to go back to your lockers, or you don't have time to go back to your offices. And so all of their personal possessions are still in that building. And that's the other reason why you want it to be secured by first responders, because you don't want those things stolen in the meantime. But what about car keys? What about medication? All those kinds of things have to be thought about and have to be in the plan for the first minutes and the first hours, because some of those medications are going to be, will have individuals that need to take them, you know, within that time frame. So this is actually, the picture that I have on here is actually a memorial service that took place 2 days after a school shooting. That's why you include first responders in your prevention plan. How are you going to respond to these individuals? How are you going to respond to these big groups? If you walk through that crowd, the thing that you would notice is there are at least 25 school districts represented at this one school shooting. Kids came from everywhere to show their respects. So you need to be able to and work with law enforcement, city service vehicles, because this is a community event. They were used to block traffic and make sure that people were safe. After the first hours, after people are, you know, settled, the other thing that happens is, remember I said you can't call everybody. What you do need to do is call the victim's parents or family members. If it's a school teacher, if it's a child, you need to have that contact information. You need to tell them where that victim is being taken and where to meet them. We sent mental health professionals to the hospital so that they were meeting with those families one-on-one when those kids were brought into the hospital by helicopter. And so that is, you know, a way to support those families through some of the very most difficult days of their lives. In the meantime, these families, all these families have, you know, day-to-day lives going on that happen despite the tragedy. And so they have daily living expenses. They may not be going back to work. They may have family situations where parents are divorced or split and do not, you know, work amicably together around their child. So those issues need to be understood and mitigated, usually with mental health professionals in the process. And the other thing that happens immediately is people start wanting to make donations. People want to make a response. They want to have a response that is positive. And so I encourage people in their prevention and response plan to identify what organization can take those for you, what organization can organize those things. People may donate food to first responders. All those kinds of things happen almost immediately, within moments of the word that a crisis has occurred. Those offers will come in. Here's the other thing, though. People will offer to come on site, and you don't know these people. They may be mental health professionals. They may be religious clergy. You don't know what their credentials are. You don't know what their background is. I literally had individuals coming on site, clergy members that came and told families at the site of the shooting that their child was supposed to die that day, that was God's plan. Now, I don't care what your religious background is and what your personal beliefs are, but that is not the time and place to share that. Not with these people that were grieving the loss of their child. So we also had on the other side, we also had people at one site send doctors in white, long white coats. You know the look, with a stethoscope, literally, long white coats with a stethoscope. They sent those people on site to the shooting. And guess what the kid's response was? Terror. Is there something wrong with me? Is there something I don't know? What's wrong? Why are these people here? Why are all these doctors here? So you want to be able to plan and have some control over the site that is part of this prevention and intervention plan. In the first days, you'll have funerals to plan for if you have a horrible tragedy. Even if you just have like the school shooting where there was one boy that walked into the bathroom and got shot by another boy in the leg. I mean, there will be, gatherings of individuals, public gatherings of individuals to remember them, to, wish them well. And so you want to have mental health people, you want to have school staff there. There will be pop-up sites all over, perhaps the city or the school, where people leave flowers, they leave messages, they send cards, they send letters. We heard from 23 countries at the shooting in Chardon, and so that is another thing that that you have to expect and plan for. All right, let's see here. Oh, here we go. Stuffed animals, flowers, all that stuff. The other thing that'll happen is there will be messages there that you don't want to see. There will be nasty signs left. There will be, messages about they deserve this, or I just can't believe the number of disturbing messages after an injury or a death of a child. And I'm sure you've heard Sandy Hook was a perfect example. There were messages fairly quickly on mass media that was made up, that never happened, that those kids never died. I actually worked with Sandy Hook. The health department got called in because they started getting mail with white powder in it, and they didn't know how to respond to that. So, I helped them kind of work through those processes with these individuals that were, and to this day, some of those lawsuits have just, are still going through the court system, suing individuals that said it was a fake process and that those kids never died. So I'm watching my time because I want to leave just a few minutes here for some open-ended questions if you'd like. So damage is, kind of determines when and how the schools reopen. In Columbine, the damage and the psychological damage was so bad they actually opened in another school for the rest of the year. The research I did on kids 3 to 5 years after they graduated from school where there was a mass school shooting showed that they never went back to feeling safe in that school. That the number of kids that felt safe was half of what it was just a few years, just 2 years before the shooting. So, and that permeates through the grades. It's not just the kids that are in that school, it's in the kids that were in the lower grades as well. And communities start to divide themselves, you know, whose fault was it? And so in the months that come afterwards, they start to do memorials. They start to think about how to, you know, make the school better. A lot of that goes back to the first thing they think about is hardening the school. And they don't really think about as quickly as, you know, the mental health of those individuals, family members. The other thing to think about is that I really want to do a research piece on is there are suicides after the shootings. Maybe you heard about Parkland had 2 suicides just a few months apart after their shooting in Parkland in Florida. So there are all these things that happen that, you know, a good plan will be preparing for. Lawsuits start within a few months, and we see evolving post-traumatic stress disorder symptoms come out in the community. We have teachers or staff that never returned to school. At Sandy Hook, we had, from some of the accounts I read, half of the first responders never returned back to work at Sandy Hook because of how traumatic the loss of all those children was. We strongly advise, I really try to set up permanent programs in schools, have them think about how to do that on a very long-term basis and really not go back. I strongly believe in educating schools about whether you have a crisis or not. I strongly believe in educating schools about what it means to be a trauma-informed school, what it means for your students, what it would look like, what your school may do differently. And so that's one of the themes I have as far as violence prevention is to create those spaces, create the school thinking about the mental health of children as often as you think about the educational structure for children, so that they can learn because they are mentally healthy and secure and feel safe. In the end, there's long-term responses as well. One of the things that happened in the first few months after one of the shootings was they removed, there was no ready parking, so they had to take the victims by helicopter to get them to the hospital. And so there were several helicopters over and over and over passing over it just so happened that they passed over an elementary school in doing that. Don't you know, months later, the elementary school, every time a helicopter, who happened to be in the path of the hospital closest to the shooting, every time a helicopter passed over the elementary school, the kids became fearful that there was another shooting. And so there's these unintended consequences that we have to pay attention to. I am coming to the end. Thanks for hanging out with me. These are behavioral responses. Like I said, I can get you the whole list of resources, the slides, everything like that. This is my email at the board, and the resources are at Rise for Solutions, RISE, the number 4, solutions at gmail.com. So, having said that, I hope you found some things that you had not thought of before. My goal, is certainly to make people aware of some of the things we found in our research. I certainly have, tried to make people think twice about the crisis plan that they have, and to start thinking about how individuals are affected in that crisis plan, what kinds of things we can do to make it better, because so often it is not child focused, it is administrator focused. And I encourage you to, reach out if you'd like to. I would be happy to, to correspond with you, to talk with others that would, you think might be, this information might be helpful to. You've been a wonderful audience. Thanks for the chat. I really appreciate that. Thanks for sticking around. I know, like I said, Saturday afternoon at 1:29 probably isn't the ideal time unless you're in 48-degree rainy weather. But I really appreciate your logging on and spending some time with me. It's been really, your insights are very wonderful to read, and you obviously are, in tune with this issue thing. So having said that, thank you all again. Email me or text me, or email me at Rise for Solutions, and I'll certainly be in touch. Thank you all.